The rectus abdominis attaches at the pubis, at the pubic crest and the pubic symphysis, and then it inserts into the xiphoid process and the costal cartilages of ribs 5, 6, and 7. And because it crosses the ribs, the trunk, and the pelvis, we know it's going to have an action in all three of those areas. At the rib cage, its main action is going to be Hey everyone, Steven here with Team Euphoric, and this week's YouTube shorts are dedicated to the rectus abdominis muscle. The rectus abdominis is one of your abdominal muscles. It's the most superficial of the abdominal muscles, and one of its actions is going to be retroversion of the pelvis, which makes it a very important muscle, especially managing something like low back pain. If you recall from earlier videos, one of the reasons why most people develop low back pain is due to dysfunction in the lumbopelvifemoral complex. And one of the most common postural faults in the lumbopelvifemoral complex is going to be excessive anteversion of the pelvis, or an anteriorly tilted pelvis. So because the rectus abdominis is responsible for retroversion of the pelvis, one of the ways in which we can mitigate that and decrease symptoms of low back pain would be to do some strengthening exercises for the rectus abdominis muscle. For the rectus abdominis, there are only two areas that we need to be covering, and that is going to be the pelvis and the rib cage. Right over here, this is your pelvis, and at the most inferior aspect of your pelvis, we have the pubic bone right over here. Right down the middle, we have the pubic symphysis, and then right next to that, we have the pubic crest, and that's it in terms of the pelvis. Then, we're going to move up to the rib cage. At the rib cage, right over here is your breastbone. We have the manubrium up top, then we have the sternum, and then at the bottom of the sternum, we have the xiphoid process. And then just lateral to that, we have the costal cartilages. And that's the only important bony landmarks when discussing the rectus abdominis muscle. The rectus abdominis attaches at the pubis, at the pubic crest and the pubic symphysis, and then it inserts into the xiphoid process and the costal cartilages of ribs 5, 6, and 7. And because it crosses the ribs, the trunk, and the pelvis, we know it's going to have an action in all three of those areas. At the rib cage, its main action is going to be depression of the rib cage. At the trunk, when they contract bilaterally, it's going to be responsible for flexion of the trunk. When they contract unilaterally, they're going to be responsible for lateral flexion of the trunk. And then at the pelvis, its main action is going to be retroversion of the pelvis, and it's also going to have a component of ipsilateral elevation of the pelvis, so elevation of the same side. But those are the only actions for the rectus abdominis muscle. The rectus abdominis is innervated by the intercostal nerves, and more specifically, your T5, T6, T7, T8, T9, T10, T11, and T12 nerve roots. And the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the rectus abdominis to fire properly, and that can lead to limited blood flow and oxygen in the area. And what we can do to address that would be to do some ELDOA exercises. The reason the ELDOAs are going to be so great is because the whole purpose of ELDOA is to create space within the joint. So if we're able to create space within the joint, we can improve the function of the nerve roots, and then the nerves are going to be able to send the proper signal to the rectus abdominis to fire properly, and that can improve blood flow and oxygen in the area. Today I'm going to be taking you through some strengthening exercises for the rectus abdominis muscle, and I'm going to be taking you through two different variations, each of which are going to be in a supine position, meaning you're going to be laying down on your back. This first one is to target the supraumbilical fibers, or your upper abdominals. We're going to go ahead, flex the knees to 90 degrees, plant the feet firmly on the floor. We want retroversion of pelvis, flat lumbar, flat thoracic, chin tucked in, crown head away, eyes looking down between our thighs to put the dura mater under tension. We're going to keep the trunk elevated, arms down by the side, and for this one, we want to go into flexion of the trunk to the level of the L3 vertebra, so the level of the umbilicus, and this is for the supraumbilical fibers. Then next, we're going to target the subumbilical fibers, or the lower abdominals. We're going to place the arms at the level of the glenohumeral angle, flex the hips and knees to 90 degrees, and with the knees, we want to project them straight up to the ceiling without going into flexion. And this is for the subumbilical fibers. We want to go up to the level of the L3 vertebra. And those were the two strengthening exercises for the rectus abdominis muscle. Today I'm going to be taking you through some myofascial stretching exercises for the rectus abdominis muscle. I'm going to be taking you through three different levels of difficulty. For the first one, you're going to go ahead and get into a prone position. For this one, the lower body is going to be relaxed. You want to maintain anteversion of the pelvis. You're going to pin your pubic symphysis down into the ground, and you want your elbows directly below your shoulders. Then, from here, all you want to do is go into trunk extension as much as you can without allowing the pubic symphysis to leave. And this is the level 1 difficulty. For level 2, all you're going to do is straighten out the arms, and you want to walk your hands as close to your body as you can, once again without allowing the pubic symphysis to leave the ground. Then for the level 3 difficulty, you're going to go ahead and get on your back. For this one right over here, we're essentially doing a bridge. So you're going to lay down on your back, bring your feet as close to your butt as you can, bring your hands underneath your head, and then all we want to do is raise our pelvis toward the sky. So we're going to go into as much trunk extension and as much anteversion as possible. And those are the three different levels of difficulty for the rectus abdominis stretch. For the T7, T8 ELDOA, we're going to be in a seated position. We want the feet together, and we're going to flex the knees as much as we can until the lumbar spine starts to round. As soon as the lumbar spine starts to round, you're going to stop right there. We want to create maximum myofascial tension in the lower body. We're going to do that by creating a lemniscate. We're going to raise the big toe up, flatten the medial arch, go into external rotation tibia, medial rotation of femur. Keep those knees nice and close together. We're going to go into retroversion of pelvis. Flat lumbar, flat thoracic, chin tucked in, crown of head up, eyes looking down at the floor to put the drum mat under tension with the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders. Flex the shoulders to level front plane, so biceps in line with the ear. Then we're going to lower the arms to the level of the glenohumeral angle. If you don't know where that is, depending on everybody's morphology, it's going to be anywhere from 90 to 135 degrees. For the average person, when your arms are fully extended and the palms at the level of your forehead are slightly higher, that's going to be the glenohumeral angle. But we're pressing away with the palms, we're going up with the crown of the head, keeping those knees together, and this is the T7, T8 ELDOA.